Dear friends, I am Dr. Sanjiv Saigal. I'm a liver specialist who has a special interest in liver transplantation. This message is for you all, but especially for those patients who have undergone liver transplantation. There is a lot of confusion and panic in the country because of the recent global pandemic of coronavirus infection, which is also known as the COVID-19 infection. Cases in our country are on the rise, and the country is in a state of almost near lockdown. So, as liver transplant patients, you need to understand what this means to you. So, I will give you some do's and don'ts and tell you about specific measures which you need to take to make yourself aware and safe from this COVID-19 infection. So, let me first tell you why it is important for you. You must understand that you are on medications which are called immunosuppressive drugs. These drugs lower your immunity, and thus there is a chance that your risk of catching the infection may be higher. And once you catch the infection of COVID 19, you may be at a higher risk of getting the complications. So, the best way is to stay aware, stay alert, and stay safe. The specific measures which you need to understand are as follows. 1. Avoid going to hospital for your routine visits. I will tell you, most of the routine consultations and routine visits, checkups can be done online or by teleconsultation. Most of the hospitals, the transplant teams have facility for teleconsultation now, and you can share your reports and take advice from the doctors in your transplant team. Of course, if you have a problem which is serious, which you think is beyond your reach, you must contact your doctor immediately and go to the hospital. Secondly, I will tell you about medications. You are on immunosuppressive drugs. These drugs include tacrolimus, sirolimus, everolimus, steroids, and so on. Please note that they are critical for your good health and stability of your graft function. So please don't alter or stop these medications. Continue the same doses and change the doses only when your transplant team doctor advises you to do so. Number 3, keep a stock of these medications. You do not hoard the medications, but please be in touch with your chemist so that you have a constant supply of these medications even at the worst of times. Number 4, about medicines to prevent COVID-19 infection. Please note that there is a huge myth that certain medications which can be taken to prevent COVID-19 infection. Let me tell you, there are no such medications as of now. The drugs which are commonly being spoken about are the HCQS and chloroquine, but they are being recommended by the Indian Council of Medical Research, which is the ICMR, for very specific indications for healthcare professionals or for somebody at house who has a lab confirmed proven contact of COVID-19 infection. So please don't do self-medication and don't hoard these medications, because I am sure you should not take these medications of your own. Number 5, if you have symptoms such as fever, cough, or shortness of breath, you must contact your transplant team or the concerned doctor immediately, because there may be a need for you to get tests for COVID-19, and this will be best decided by your transplant doctor. Lastly, you must stay well hydrated, have a good balanced diet, because it's very important to have a good strength to fight this infection and stay safe and healthy at all times. Besides these specific measures, I would also emphasize that routine practices which you are already aware you should follow again and again, such as staying indoors, maintaining social distancing, which is more than 6 feet or 2 meters, washing your hands with soap after touching any surface, wearing face mask, following cough etiquettes, and so on. So with all these measures, if you follow, I'm sure you can stay safe, stay healthy and happy at all times. Thank you very much.